Hello and welcome. I'm Barbara Wilson Arboleta, voice and communication coach and speech language pathologist. If you'd like to see more voice, health, and communication content, be sure to like and subscribe before you go. If you get confused about what's covered by your health insurance and why, you're not alone. Today, I'm going to talk to you about the concept of medical necessity in the United States healthcare system and how that interacts with your health insurance. We all know that the US healthcare system is kind of a maze. And when it comes to insurance coverage, a lot of people assume their doctors and other medical providers are insurance experts who know exactly what's covered and when. And unfortunately, that's a no. It's an impossible task. With hundreds of insurance companies and thousands of plan variations, there's actually no way for your medical provider's office to completely understand your coverage. Each insurance plan is unique with its own set of rules for coverage, co-payments, and deductibles. And then insurance companies also categorize different medical providers into different tiers. And the tiers are different based on which plan and which company you're with. And this system makes some providers more expensive than others and can limit your choice of providers to a closed network. And I do have a video on tiers, on co-payments, co-insurance, and deductibles. So be sure to watch that if you'd like to know more. Now, let's come back to the idea of medical necessity. Now, we think we know what that means, but insurance companies and plans each have their own definition of medical necessity, and they kind of hide this information away like grandma's secret cookie ingredient. And what you consider medically necessary might not align with your insurance's definition. And then when you change insurance companies, the medical necessity of your condition might change too, which then leaves you with claim denials, unexpected bills, and just a lot of hassle, unfortunately. Now, if you want to seek clarity, good luck. You can call your insurance company and they'll most likely tell you this: if it's medically necessary, it's covered. Now, that sounds great on the phone and when you're in a hurry. What they may not tell you is whether or not your condition and the recommended treatment is considered medically necessary by your insurance company and your plan. Now, we all know that claims are processed by a computer. The information is in there somewhere, and it's all a game. But believe it or not, they often won't tell your doctor with clarity either. So when I was back in private practice, one insurance company told me after a lot of back and forth to have the patient come in, receive the service, and then see if the claim was denied after the fact. They weren't interested in the diagnosis and treatment codes I could give them, and they didn't care that the patient would then get a bill for the service if it was denied. Yeah, stellar. There are programs, these computer programs that are connected to hospital systems, and these are supposed to tell us something about your insurance coverage. But they usually only provide basic information like plan status, which is whether or not your coverage is active, and co-payment information. And it might tell us if you need an insurance referral from your primary care physician, or maybe it won't. I don't know. Specific coverage information based on your diagnosis and treatment is often not available. And yeah, this is stupid frustrating for everyone, and it wastes a lot of time. You might do everything right, getting your referrals and your authorizations, but then each document they send back to us carries the disclaimer that this authorization is no guarantee of payment. I mean, really? What's the point then? Why go through all this hassle, right? Consider the recent Cigna scandal where they started using AI systems to just auto reject claims. Yeah, sure. That's ethical. I mean, honestly, it does feel kind of hopeless at times, kind of like as both the patient and the provider. What can you do? Well, you can start by looking at your plan information before you need medical help. Like, get in touch with and familiarize yourself with your plan's tiers, deductibles, co-payments, co-insurance. And if you're not familiar with what these things are, definitely watch my video because it explains it all. Your plan information will also break down different categories of coverage. For example, emergency room, office visits with your primary care physician, office visits with a specialist, rehabilitation therapy, et cetera, right? And this will get you started. For example, I know that in my plan, if I get emergency treatment at a tier 1 hospital, I'm going to pay a $200 copayment, unless I'm admitted to the hospital as a result of my visit, and in that case, the copayment is waived. I know that a copayment for a tier 1 specialist is $35, and the copayment for a tier 2 specialist is $55. And I got this information from my plan coverage document. When you're considering looking at like a complex medical treatment like surgery, you want to see if you can get the diagnosis and procedure codes from your medical provider. Then you can call your insurance and see what more information you can get about what's covered under your plan. Now, there are going to be times when your provider won't have the codes yet, right? They can't diagnose something that they haven't evaluated yet. So you might have to wait until that first appointment before you can get your diagnosis codes. If you want to know more about medical codes, I have a video for that too. You should also know, though, that there may be times when the benefits manager at your employer negotiates away certain coverage in order to keep costs lower. For example, there's a large insurance plan in Massachusetts that negotiated away all speech pathology services unless a person has had a stroke. In this case, their documentation states that the lack of coverage is due to the plan coverage guidelines and are, quote, not a reflection of medical necessity, end quote. Now, believe it or not, you calling your insurance company yourself is more likely to get you the more accurate information than if we call them. Now, if you can't get the information you need, the benefits manager at your employer, if you have one, might be able to help push the matter because, in fact, the insurance companies don't want to make their real customer, your employer, upset. Well, anyway, thanks for watching. For more insights into healthcare, voice, and clear communication strategies, don't forget to like, share, and subscribe. Until next time, stay informed and stay healthy.